Hi, Dr. Fedy here. A 41-year-old woman was rushed to the hospital with a problem that made no medical sense. Her body began to swell in a way that defied explanation. First her legs, then her lower body, then her arms, and eventually her face. Within days, she could barely walk. Her eyelids were so swollen that she could no longer open them. She described the sensation as drowning from the inside, and physicians were so perplexed. She had no prior episodes like this one, she had no chronic diseases, no warning signs. She was previously absolutely healthy. But that wasn't all. She was rushed for urgent imaging and the findings were even more shocking. Fluids compressing her heart, fluids compressing her lungs, fluids pooling throughout her abdomen. Her body wasn't just swollen, it was like it's flooding from the inside out, and her physicians had no idea what was causing it. So let's call our patient JT. JT's story actually began 2 years before the swelling appeared, when she was diagnosed with frontofibrosing alopecia. Alopecia being the medical term for hair loss. FFA is a slowly progressive scarring type of alopecia. It often appears in women, usually after menopause. We still really haven't pinned down the exact cause, but one of the leading theories is that the immune system starts attacking the hairline as if it was a foreign body. That chronic inflammation eventually scars the follicles, making the hairline creep backwards. Over 2 years, JT tried every conventional therapy, but nothing really worked. She was understandably extremely distressed by her condition as she watched her frontal hairline retreat nearly 5 inches, and the recession along her temples became impossible to conceal. Eventually, going outside required covering her hairline with a band, a routine task that became emotionally exhausting. But what made this even worse was the sense of urgency JT felt. See, in later stages of the condition, once FFA scars a follicle, the loss becomes irreversible. Even a hair transplant could not be done once that point has been reached, as scar tissue lacks the necessary blood flow needed for hair grafts to grow following a hair transplant procedure. This basically meant that JT had to act, and she had to act really fast to save her hair. Time was crucial. And so exactly 3 weeks before the swelling began, JT revisited her dermatologist, hoping for anything that might halt the progression. She was started on a combination regimen of topical minoxidil 5% solution. This is, as a lot of you know, the most prescribed topical treatment for hair loss. She was also started on tacrolimus 0.1% ointment. This is an immunosuppressant used here to suppress local inflammation. She was also started on clobetasol propionate, which is a very potent topical corticosteroid used for the same purpose as tacrolimus. She was started also on doxycycline, which is an antibiotic but used here for its anti-inflammatory properties, and she was started finally on 0.25 milligrams of oral minoxidil daily. Minoxidil was actually a drug that actually started as a blood pressure medication back in the 1970s. Doctors quickly noticed that patients were growing more hair, and that unexpected side effect is what eventually led to its use for hair loss off-label by some doctors, although this remains extremely controversial even to this day. So approximately 3 weeks after starting this treatment, JT started feeling an unusual heaviness in her legs. By the next morning, they were visibly swollen. Over the next few days, the swelling progressed relentlessly, rising from her legs to her abdomen and then her upper extremities, her face, and even the eyelids. When her dermatologist saw her, she was unrecognizable by that point. JT was a previously healthy woman. Such generalized swelling, especially of this magnitude, is extremely uncommon at that age. And when encountering widespread edema, which is the medical term for swelling, physicians typically initially consider 3 major causes: renal dysfunction, thyroid gland abnormalities, and cardiac pathology. Her kidneys tests were normal. Her thyroid panel was also within the normal range, and so that left only one organ system to eliminate. JT was referred straight to cardiology and she was admitted immediately. On examination, JT exhibited diffuse pitting edema in the lower limbs, in the thighs, in her abdominal wall, sacral area, face, including the periorbital region, which is the area surrounding the eyes. Pitting edema basically means that when you press your thumb into the skin, the indentation made by your finger remains, and this is a sign that can orient towards the cause of the swelling, as pitting edema is often caused by cardiac or renal issues. In contrast, non-pitting edema typically results from lymphedema or hypothyroidism, which is the dysfunction of the thyroid gland. By that point, JT was deeply distressed. It was hard enough grappling with her constantly shifting appearance, and now she was watching her body swell like a balloon. But that wasn't all, as doctors rushed her for an ultrasound, and what they found was even more alarming. Pericardial effusion, which is fluid surrounding the heart, pleural effusions, which is fluid surrounding her lungs, and ascites, which is the medical term for fluid in the abdomen. JT had anasarca, the most extreme form of edema where fluid infiltrates nearly every tissue of the body. This form of swelling is physiologically dangerous because of a couple of reasons. It can push fluid into the lungs, causing pulmonary edema, basically impairing the lungs' capability of effective gas exchange. It can overwhelm the heart, causing acute heart failure. It can disturb electrolytes, causing deadly arrhythmias, and in severe cases it can even dangerously drop the blood pressure levels, leading to a state of shock, an acute condition that frequently ends with death. So basically, JT's entire body was reallocating fluids into places it was never meant to be. She was immediately started on IV furosemide to force diuresis. Furosemide is a powerful medication that forces the body to dump excess fluid through the kidneys, but symptom control wasn't enough, as physicians needed to locate the source of the fluid before it comes back. A meticulous review of her recent medications revealed the culprit: oral minoxidil. Minoxidil was originally developed as a vasodilator for severe hypertension. It relaxes blood vessels, lowers systemic vascular resistance, and increases capillary permeability. When blood pressure drops too much, fluid can leave the bloodstream and accumulates in tissues. Even at low doses used in dermatology, oral minoxidil has been found responsible for peripheral edema, rapid water retention, causing sudden weight gain, pericardial effusion, and even cardiac tamponade. And this was precisely JT's case. And so oral minoxidil was discontinued immediately. She continued furosemide 40 mg IV daily for 4 days with potassium supplementation. This is because furosemide, also in addition to draining out water, can drain out important electrolytes like potassium, which can disturb the electric function of the heart, and it's for this reason that we often supplement patients with potassium to keep the heart safe while they're on high doses of furosemide, like in heart failure patients. By day 4, JT's swelling had dramatically receded, her breathing normalized, and she could finally open her eyes again. The fluids compressing her heart had completely resolved, and she was discharged after 7 days of being admitted into the cardiac unit. So this case occurred in 2022, and I wanted to highlight it and speak about it on my channel for 2 different reasons. The first one is that lately I've been seeing a huge surge of popularity of oral minoxidil, and a lot of people have been advocating for its usage off-label for hair loss purposes. As a lot of you guys know, I have a YouTube channel focusing on hair loss and especially androgenetic alopecia, which is the kind of hair loss that affects men. And so I've been seeing this trend of people using oral minoxidil off-label, sometimes even without consulting with their doctors. And I wanted to make this video to emphasize how important it is to be aware of these side effects of oral minoxidil. I've been super clear about my position regarding using oral minoxidil for hair loss. I think it is not safe, it's not worth the trouble, and especially we have a handful of FDA approved treatments for hair loss that already proved their efficacy and safety profile, like minoxidil and finasteride, and for most people that would be more than enough for halting the progression of their androgenetic alopecia until they get their hair transplant if they ever needed one. And the second reason why I wanted to tell this story is because of something positive. I liked how JT was following up with her doctor, rushing to her doctor as soon as she felt some symptoms, which not a lot of people do these days. A lot of people just Google their symptoms or ChatGPT their symptoms, which is something that can be very dangerous. In JT's case, following up with her doctor, asking for help from a medical professional, I believe saved her life, because if she would have continued to use oral minoxidil, she would have definitely proceeded to have a cardiac tamponade case. That wasn't the case, and I think this speaks a lot about the importance of following up with your doctor, especially after you start a new treatment, no matter how you think that treatment is safe. Always consult with your doctors and do follow-ups after starting new treatments. So that's it, guys. I hope you liked the video, and we'll meet in the next one. Stay safe.